Hi friends, today we'll be looking at pericarditis, which is the condition, or rather which involves the inflammation of the heart, so to speak. And as you know already, when you're talking about pericarditis, the suffix itis, we're talking about the inflammation. Then the pericardium, this is the outer layer of the heart which encloses the heart, to which first thing you need to understand the anatomy part of this pericarditis. And secondly, you need to know the function of this pericarditis as being the layer of the heart which prevents the heart from over distension that can make it more prone to rupture. So this pericarditis, it has the layer of fibrous tissue which provides the strength of the heart to prevent it from rupturing or over distension. It also has the visceral part, the visceral layer, which provides the adhesion of pericardium to the myocardium, which is the second layer of the heart. And in between the pericardium, it has the serous fluid that is found in the potential space. And the function of this fluid, it prevents the heart from friction as it is contracting and relaxing. As you know already, the pumping action of the heart consists of relaxation and contraction. So to avoid the friction, there is the fluid which acts like as a lubricant. So straight away, let's talk about the description of this pericarditis. So we are saying that pericarditis is an inflammation of the pericardium, which is a sac-like structure with the thin layers that we have talked about, and it surrounds the heart to prevent it from over distension, just like we have mentioned earlier on. Now, what can be the cause of this inflammation of the pericardium? Most cases, the cause of pericarditis, it is idiopathic. What do you mean by this? There are possibilities whereby the heart can be inflamed without an underlying cause. So it is just found to be inflamed, but no cause that is identified. That's what we mean when we say it is idiopathic. And sometimes pericarditis, it can be caused by the viral infections. As infection occurs through the body, you find that the body is going to respond to this inflammation. Remember our previous lecture, we talked about inflammation as being the response that the body is going to portray in an instance where it is manifested with injuries or infection. So in an instance whereby there is an infection that is caused by viruses, the body is going to respond to that infection through the process of inflammation and making what we call pericarditis. And sometimes it can be caused by the respiratory or digestive system infections. For example, when you talk about the pharyngitis, whereby the complication of pharyngitis is going to lead to rheumatic fever. Rheumatic fever ends up into rheumatic heart disease. And in this disease, that's the very infection that you're talking about, where the body is going to respond through the process of inflammation, making pericarditis. So these are some of the causes of pericarditis in this case. So here we can see the visual aid that is showing the diagram of the heart. So when you cut the heart, that's the diagram that you're going to see, and you'll be able to see the layers of the heart in this case. So when you look closely to this diagram, you'll be able to see that this layer, that's what we're talking about in this case. So when you cut this layer, when you magnify it or enlarge it, under normal circumstances should appear like this diagram above here, which we can see. So we can see the regularity of the layer of the heart, which shows that they are normal, the layers of the heart. But when you talk about this layer that is being shown below here, it is showing the irregularity of the layer of the heart. As we can see, this layer that is showing a light blue like, this is the layer that is found in between the pericardium. Remember, we talked about two layers that makes up the pericardium. There's parietal pericardium and visceral pericardium. So in between, there's a fluid that is shown there. So you find that in this part, it is going to be inflamed. Having looked at what can causes pericarditis and what is meant by pericarditis, there are types of pericarditis that you need to know in terms of the classifications. Remember, our goal of knowing this, we need to be able to understand the condition, so as being able to manage the condition when we are faced with a patient who is presenting with that condition. So for you to be able to provide the effective interventions, or rather an appropriate medical intervention to this patient, you need to understand the types and the approach to use in this case. So there are four many classifications of pericarditis. The first one, it is an acute pericarditis, whereby the inflammation of the pericardium, it is of a short duration and it doesn't last longer than 3 weeks. So that kind of inflammation in the heart is called an acute inflammation or an acute pericarditis. We also have recurrent pericarditis. With this one, when you say recurrent pericarditis, we mean the episodes of these conditions. When the person is managed with this condition, after some times, maybe about 3 to 4 weeks, you find the person will have the very conditions that they had earlier on. And in this case, that's why we're saying recurrent. It keeps on recurring after being managed. Also, the episodes, they follows that. And you find that in between the two recurring pericarditis, there are no signs and symptoms that are going to be shown. The signs of inflammation, those major 5 signs of inflammation. The other 2 types that have remained, there's incessant pericarditis. With this one is a type of inflammation of the pericardium which lasts more than 3 weeks, but it doesn't go up to like 3 months. It is of short duration as well, but more than it is with the acute. And what makes it different from acute and that of recurrent is that with this one, the signs and symptoms are going to be continuously seen. Quite alright. An acute, we said that there will be signs and symptoms, but it is going to end within 3 weeks. Recurrent, there are going to be episodes, but with no signs and symptoms in between one manifestation. In this case, with incessant pericarditis, it is going to last more than 3 weeks with continuous signs and symptoms of an inflammation. And lastly, there is a chronic constrictive pericarditis, which is of long duration and it lasts longer than 3 months. So these are the 4 classifications of pericarditis that we can talk about in this case. And on top of those causes that we talked about, we can also talk about the heart attack and heart surgery. This can trigger the inflammation due to the disturbance that is going to be caused. For example, let's say the person had rheumatic heart disease, then there's a surgical procedure that has been taken place. So that disturbance, the body, when it responds, it will result in an inflammation. And sometimes it can be post-myocardial infarction, whereby there's an inflammation of the myocardium, which is going to make the pericarditis to manifest. Then there's also systemic inflammatory disorders like rheumatic arthritis, just like we have mentioned in an instance of rheumatic heart disease. There's a trauma. Trauma, in this case, we can talk about an injury that can be caused by the blunt objects or penetrating objects that is going to pierce the heart and making an injury. Hence, the body is going to respond. What you have to keep in mind is that when you're talking about inflammation, or what we are saying is just the response that the body is going to produce in an instance of injury or infection. So in this case, an injury or trauma can result in inflammation. Then you can also talk about health disorders like kidney failure, AIDS, tuberculosis or cancer. All these conditions can lead to carditis. In what sense? You find that the body, it is going to produce some immune cells that are going to be sent to attack the foreign bodies. But as they are attacking these foreign bodies in these underlying conditions, also the structures that are invaded are going to be attacked by these immune cells, causing an inflammation of the heart, specifically carditis or pericarditis. What are some possible signs and symptoms that you are going to see in the person who is presenting with pericarditis? First thing, you'll be able to see the sharp stabbing chest pains that is going to come from inflammation. Remember, one major sign and symptoms of inflammation, it is pain. So pain, it is going to manifest in the chest. Why are we talking about the chest? Because that's the location where we're going to find the heart containing this pericardium. Then there's also the pains that comes more especially in the left side of the heart or at the middle side part of the heart. because of the location. Still, we are talking about where the heart it is going to be found. It is actually in the mediastinum, but more to the left, especially the apex of the heart. So that's where the pain is going to be found. Then there will be fatigue or general body malaise that is going to come due to the fact that when the heart is inflamed, it will fail to function and supply the blood to distant cells, and it is in the blood where you're going to find the nutrients and the oxygen that the cells need for them to produce the metabolic processes. But when the heart is inflamed, is failing to supply that, then the cells are going to starve from nutrients and the oxygen, hence no metabolic mechanism taking place, and fatigue will manifest. There will also be low-grade fever. Fever is only the pyrexia or the increase in temperature due to the fact that there is antibody-antigen reaction taking place due to the fact of the presence of maybe viral infections that we talked about as one of the cause of pericarditis. And we are going to see heart palpitations. Heart palpitations due to the fact that the heart is failing to pump blood. Remember, one sign or symptoms of inflammation is swelling. So when the heart gets swollen due to the fact of accumulation of fluid, it is going to have difficulties in its pumping mechanism, hence making heart palpitation, and the shortness of breath when lying down due to the very accumulation of fluid that are going to be caused in the heart. And also the lungs are going to be affected because blood from the heart goes to the lung for oxygenation, and when this heart is inflamed, it means that the heart, it is the blood that is going to go to the lungs for oxygenation is going to be limited, hence making shortness of breathing and also dyspnea, which is the difficulties in breathing due to the accumulation of fluids. Now, how will you be able to diagnose this pericarditis? How are you going to tell that actually this is pericarditis? Because all those signs and symptoms that we talked about, they are presumptive in a sense that they can also be manifested in other conditions. But how will you be convinced that actually what you're dealing with is pericarditis? You are going to do a chest x-ray that is going to view the structures of the heart. You'll be able to see the accumulation of a fluid within the pericardial space, which is parietal and the visceral layer. That is going to rule for inflammation, and it is going to show pleural effusion. You're also going to do CT scan, which is computed tomography. It is going to show the detailed images of the heart, all the damaged cells due to an infection that is going to be caused by viral infections or other microorganisms that are pathogenic in nature. You can also do ultrasound testing that is going to show the waves of the heart as it is pumping, and it will be producing the heart murmurs that we talked about. This ultrasound testing specifically, you're going to do the echocardiogram, where you'll be detecting the waves in terms of the sounds that the heart is producing as it is contracting and relaxating in order to supply the blood. You can also do the ECG, which is the echocardiogram. This one is going to record the rhythms of the heart as it is pumping blood. So you are going to see the waves on the screen of the computer that you are using to detect the contractility of the heart. So in an instance where the heart is inflamed, then it is going to show weak waves that are going to be produced, and it will rule for the presence of the fluids accumulating, the cellular fluid accumulating within the pericardium, making the heart failing to pump blood. Then you can also do laboratory testing, where you're going to do blood culture. You rule for the presence of microorganisms that can be a sign of a systemic infection. You can also do MRI, which is a cardiac magnetic resonance imaging, that is going to show the cross-section of images of the heart, and you'll be able to see the inflamed substances on the heart itself. So by so doing, you'll be able to know that this is what you're dealing with. Here there's a visual aid that is showing the inflammation. Redness, or what we call rubor, is the sign of an inflammation. Then there's the swelling that we can see there. In surgery we call it tumor, so that's a sign of inflammation as well. Then the person will manifest with the pain, or what we call color, and also we are going to find the loss of function. Remember, we said the heart will fail to pump due to the accumulation of fluid, hence we'll have loss of function, which we call functionless. So that's what we are talking about. How are you going to manage the patient manifesting with pericarditis? Having looked at how we can diagnose and how we can come up with a clinical evidence that actually what you're dealing with is pericarditis. First thing, you are going to manage the medical management. It will be with an aid of the signs and symptoms that have been detected. So you try by all means to eradicate those signs and symptoms. For example, we talked about pain, hence you are going to give pain relievers like aspirin and ibuprofen. These analgesics that also contains antipyretic in them. There's also anti-inflammation, anti-inflammatory properties. There's also antiplatelets properties in these drugs. So in this case, you are giving aspirin and ibuprofen to manage the pain. Then you can also give colchicine, which is actually the anti-inflammatory drug, so as it to reduce the inflammation of the pericarditis. You can also give a corticosteroid like prednisolone, which is also the drug that fights an inflammation. So medically, this is what you are going to put in place to combat the presence of an inflammation in the pericardium. Then surgically, it depends with the severity of the inflammation. Sometimes, if at all medical management has failed, this is when surgical management can call for attention. So what you're going to do, you can do pericardiocentesis, which is the draining of the fluid within the pericardium, so as to allow the myocardium or the heart to attain its contractility, so that it can have the room to relax and decontract in order to eject blood to all parts of the body. You can also do the pericardiectomy, which is the surgical removal of the pericardium, because the inflammation has surpassed its possibilities to retain its function. Hence, it is going to call for the surgical removal of the whole of the pericardium, which means the person is going to remain with two layers of the heart, which is myocardium and the endocardium, and more prone to heart damage due to the fact that there is the outer layer that is to provide the protection from rupturing. And the possible complications that they can come due to the fact of pericarditis, more especially when it remains untreated or it undergoes undertreated. There's a cardiac tamponade, which is the high accumulation of fluid within the pericardial space. So it is going to worsen the condition that can even lead to cardiac failure. And we can also have bacterial complications due to the fact that there will be opportunistic infections that are going to take advantage of a suppressed immune system. Hence, you have sepsis, which is the presence of microorganisms within the blood and supplying it to the distant organs, causing the systemic infection. You are also going to have chronic heart failure due to the fact of accumulation of fluid. Hence, the heart will fail to pump blood, and causing it to fail from congestion. And we can have recurrent pericarditis, just like we have mentioned under the classification of pericarditis. So the person will remain with the episodes of pericarditis if at all it remains undertreated. Thanks, friend. This is all what we had for today. And don't forget to subscribe, like, share the videos for more updates. Remember, we've been talking about pericarditis. Have full understanding on this one more and more.